What is the pharyngeal stage in swallowing issues? Imagine swallowing as a carefully choreographed dance where muscles and nerves work together seamlessly. The pharyngeal stage is a vital part of this process, happening automatically once you start swallowing. During this phase, the food or liquid that you have prepared in your mouth moves from the back of your tongue into the throat area, called the pharynx, and then into the esophagus to reach your stomach. At the same time, your body protects your airway by closing your vocal cords and larynx to prevent food from entering your lungs. This coordination is essential for safe and effective swallowing. In people with multiple sclerosis, or MS, this dance can become disrupted because nerve signals that control these muscles are damaged. MS affects the central nervous system, which includes the brain and spinal cord, leading to issues with muscle coordination and timing. As a result, the pharyngeal stage can be delayed or weakened, causing what is known as dysphagia or difficulty swallowing. One common problem is a pharyngeal delay. This means there is a lag between when the food reaches the back of the mouth and when the swallow reflex kicks in. Because of this delay, the airway stays open longer than it should, increasing the chance that liquids or saliva might slip into the airway. This can cause coughing, choking, or even lead to aspiration, where food or liquids enter the lungs, raising the risk of pneumonia. Other issues include reduced pharyngeal contraction, where the muscles in the throat do not squeeze tightly enough to clear the food down properly. This can leave residue in the throat after swallowing, which might later be inhaled into the lungs. There is also decreased hyolaryngeal excursion, meaning the upward and forward movement of the hyoid bone and larynx is limited. Normally, this movement helps close the airway and opens the upper esophageal sphincter to allow the food to pass smoothly. When this movement is impaired, food can get stuck in areas like the piriform sinuses, increasing the chance of aspiration after swallowing. These problems happen because MS damages the nerve pathways that send signals from the brain to the muscles involved in swallowing. The process relies heavily on signals from the brainstem and cortical areas, which can be slowed or disrupted due to demyelination, the hallmark of MS. This nerve damage affects the timing and strength of muscle actions needed for safe swallowing. Clinically, these issues often show up as difficulty swallowing liquids, frequent coughing or choking during meals, a sensation of food sticking in the throat, and a higher risk of developing aspiration pneumonia. Healthcare professionals can evaluate these problems with specialized tests like videofluoroscopic swallow studies, which provide real-time images of the swallowing process and help identify specific dysfunctions. Managing swallowing issues in MS usually involves working with speech-language pathologists. They can recommend exercises to strengthen swallowing muscles, suggest diet modifications such as thickening liquids to make them easier to swallow safely, and teach techniques to improve coordination. Early detection and intervention are key to preventing complications, maintaining proper nutrition, and improving quality of life. In summary, the pharyngeal stage in MS swallowing issues refers to the phase where nerve damage causes delays or weaknesses in the muscles that protect the airway and move food from the throat into the esophagus. These disruptions can lead to unsafe swallowing, increased choking risk, and respiratory problems. Always consult healthcare professionals for personalized assessment and treatment options to ensure safe swallowing and overall health.